Good afternoon and welcome to the COVID-19 media briefing on March 2nd. Today you'll hear from Mayor John Tory, Dr. Davila, and Councillor Joe Cressy. Go ahead, Mayor.
Well, good afternoon. I do want to start today by acknowledging the death and destruction that we continue to see in Ukraine. We join the Government of Canada in continuing to condemn the attack on Ukraine and on its sovereignty, and I say we in the sense that I think all of the people of Toronto are very much joining in this condemnation and in our solidarity with Ukraine. We stand in solidarity not only with the people of Ukraine and with the country itself, but also with our very large and wonderful Ukrainian-Canadian population here in the City of Toronto. I should mention that Toronto and Kyiv have a 30-year-long, very special relationship. I met the Kyiv Mayor, Vitaly Klitschko, in person in 2017. I welcomed him right here to the Toronto City Hall, and I spoke with him virtually last year. And I salute his courage as he leads his city through what can only be described as a nightmare. I want the people of Kyiv to know from their friends in the City of Toronto, from the Mayor, and on behalf of all the people of the City of Toronto, that we stand with them at this terrible and most challenging time for them. It's horrifying to see a city under siege, to see freedom-loving people sheltering for safety in their own subway and being targeted for airstrikes, which are hitting residential buildings and a Holocaust memorial, among many other things. And so we will not stop doing what we can do here to draw attention to this unlawful invasion of Ukraine and to urge the leadership of Russia to stop this aggression. And I've been asked quite a few times what people here can do. And aside from standing up and being counted at things like the wonderful solidarity demonstration here last Sunday at City Hall, people can, of course, donate to the relief organizations that are helping, and some of those being matched by the Government of Canada, one being the Red Cross. They can put their names forward as people who are willing to help in the resettlement of refugees who will be coming before too long, and they will join many other refugees here who have made such a magnificent contribution to the building of our city. So those are things that people can do. Now, as the provincial reopening continues, we are still making progress, helping residents to get vaccinated. And it's progress that we're making door to door, street to street, building to building, and it's work that requires our continued attention, but it is work that is happening and progress that is being made. To date, more than 6.77 million vaccine doses have been delivered by Team Toronto to residents of the City of Toronto. The only reason we're able to proceed with the reopening that we're in the midst of doing as a province and as a city is because so many residents have stepped forward to get vaccinated. Even as we reopen with cautious optimism, our work to help residents get vaccinated, especially now with hyper-local clinics, is going to continue nonstop. I'm proud to announce today that our Vax and Read clinics in Toronto, public library locations across the city, will be rolling out this month. Starting today and over the next 2 weeks, Vax and Read will see 22 vaccine clinics in 12 Toronto Public Library branches and locations across the city, locations that are principally in areas of the city that have under-vaccination rates at the present time. We are continuing to do everything we can as a city government with the cooperation of all the members of Team Toronto to reduce barriers to vaccination. And that is so that we can enable ease of access and ensure that all Torontonians get vaccinated, no one is left behind. So that means, as we've said all the way through, and we've been trying to do one method after another to do this, and all of them have their place, it means meeting residents where they live, where they work, where they play, including at their local library, and then making the opportunity available for them to get vaccinated in those locations. This hyper-local, equity-focused strategy has proven to be effective. And I'm so proud of the work that all of our Team Toronto partners are doing to help bring this to life. Now the Toronto Public Library system, and previously we weren't able to take full advantage of the libraries because many of them were closed under different public health restrictions that were in place. These clinics in the libraries will offer first, second, third, and pediatric doses. Both Pfizer and Moderna will be available. They will operate on a walk-in basis, so they're very easily accessible in that respect. No appointments are required. You simply can drop into any one of the library locations at any time that is convenient to you within the hours of operation, and all of that information can be found at toronto.ca/COVID-19. This is another example of every single part of the city, without exception, working together to help residents get vaccinated, and I want to thank the Toronto Public Libraries and all of their team for working with us to help host vaccine clinics across the city. I'm also excited today to provide you with an update on the COVID-19 vaccine engagement support grants. This has been the financial foundation of the work that we've been able to do on a local, community basis to engage people who are trusted, people who are experienced, people who are known, to help us with the effort of getting people vaccinated and supported across the city. You'll recall last year we announced the continuation of grant funding for vaccine engagement, followed by an extension of the Vaccine Engagement Teams program to July the 1st, 2022. Organizations are being notified now of the allocations of $4.5 million in new funding that we are providing to the community services sector to support COVID-19 vaccine engagement. The city's vaccine engagement teams are an integral part of the city's COVID-19 community mobilization and engagement plan. And so what this does, this $4.5 million, is to fund engagement teams in 17 geographic and population-based groups. And this ends up consisting of more than 200 community and health-based groups and faith-based organizations as well that can help us to focus on vulnerable residents in areas of Toronto hardest hit by COVID-19 and areas that are often as well underrepresented in terms of receiving vaccines. Through this work, we've had over 600 local and trusted resident ambassadors work to make connections with their community members, people who know them, people who they know, and who they can approach on the street or in buildings or anywhere else to help address barriers and hesitancies about getting vaccinated, provide information about vaccines and about vaccination options. For the community and by the community, ambassadors have been key points of contact for us in the neighborhoods where they live and work, reflecting the diversity in culture, race, language, and background of the different communities that make up this most diverse and wonderful city. This has enabled us to carry out a focused and targeted approach to reach those who have been most impacted by the pandemic, and this has included Black and Latin Canadian Hispanic Torontonians, 2S LGBTQ+ communities, people experiencing homelessness, people with disabilities, seniors, South Asian, Southeast Asian, and West Asian Torontonians. These are groups that have been harder hit by the pandemic, who have shown rates of vaccination lower than the rest of the population, and if we're following our own mandate that we gave to ourselves to say no one would be left behind, then we have to focus on these groups using these ambassadors and others who are trusted to bring home the message and to bring people to the vaccination clinics. It also has helped us with undocumented people, with some segments of the youth population, and with newcomer groups. Community-based collaboration is effective and it's critical, especially as we shift to a hyper-local, equity-focused strategy. It's working, and it's important that it continue. I have met many Toronto residents, and I've often been at these clinic visits with Councillor Cressy, and I often ask them, as he does, how did you find out about this clinic? What brought you to be here? Because at this later stage of the effort, it is interesting to know what would have motivated someone to come, what contact would have helped them to make the decision to come and get vaccinated. And many of them mention the ambassadors, people who've come to their door, literally knocked on their door, talked to them and comforted them with respect to vaccination, and ended up convincing them to come. And they mention as well, I should say, the phone calls, the emails, and the text messages they get. Many of them mention those, so those have proven to be a very worthwhile investment that we have made to get people vaccinated. In 2021, these engagement programs engaged 1.5 million community members through the work of the vaccine engagement teams. I should tell you that this funding stream will help us to continue this work as we continue to advocate for the public health of all Torontonians, and in particular to get those who are not yet vaccinated. And I want to thank the Province of Ontario because they've assisted us financially to make these efforts available. The cooperation between the city and community partners is having a positive impact on the health of all of our communities and on the city as a whole, and has not been lost on me as something that we should continue to use as a model going forward for other things that often are very challenging for us in terms of delivering services and support right at the grassroots level. These activities by these groups will include training sessions, door-to-door visits, social media campaigns, and engaging with grassroots groups to get more people to get vaccinated. I want to also send a thank you to all the staff here at the city who have done the work to allocate this money to all the different groups. And you're looking at 200 different groups. There's a process you have to go through to find those that will be most effective and most trusted to carry out this work and to allow them to make the difference that they're making. I would also like to provide an update today on the city's VaxTO campaign and how we're using it to encourage people to get their third dose, because of course we've done extraordinarily well global in our achievement in terms of the standard on getting 2 doses, and we're doing very well on third doses, but it's something that's a work in progress. VaxTO helps to connect residents with information and resources about COVID-19 vaccinations using similar techniques to a Get Out the Vote campaign. Starting this week, the VaxTO campaign will shift to live calling. Before, we've used recorded messages, we've used emails, we've used texts, as I mentioned. We're now going to go to live calling so there can be more of an interaction between the person receiving the call and the person making the call. And those calls will be made to all of those who are eligible to receive a third dose but not done so as yet, and encouraging them to do so right now. The calls will target adults who are 50 and over. This is the age most at risk of severe illness or effects in the event that they contract COVID-19. If you look at the recent Toronto data, it shows that among those 60 years of age and older, individuals with only 2 doses of vaccine were 4 times more likely to be hospitalized for COVID-19 illness than those who had received 3 doses of COVID-19 vaccine. Through the VaxTO call center, live agents will be phoning nearly 40,000 people across 13 neighborhoods in Toronto, with the highest number of eligible residents who have not yet received their third dose. Agents will provide information and help address issues of vaccine hesitancy or other concerns or questions that residents may have, but we'll be reaching right to the person and allow for that interactivity through a live call. I should say that Councillor Cressy has been quite involved in putting this initiative together, and he will comment on how it's going to be helpful to us in more detail in today's update. Our goal, and it continues to be the same, it is to reduce barriers to vaccination and to vaccine options and make sure that no one is left behind in our vaccination campaign. It's working, and it's important that we continue with it, especially now as we shift to a hyper-local, equity-based strategy that is targeting people who are underrepresented in the ranks of those who are vaccinated and therefore stand a much better chance of staying in good health or avoiding severe health consequences. I look forward. I'm feeling very good these days about where we are and all the things we've achieved. The city is united. You can't have a city that is less than united if 90% of people have done something together. And they've gone out at different times, in different ways, in different places, and got vaccinated. And that has unified us in the cause of keeping each other healthy. And now we just have to continue to make sure we do the extra work through VaxTO to safeguard the health of those who have not yet done all that they could do, and make sure that this then has a lasting and positive impact on the recovery of our city, which we're very much focused on bringing about. I would now like to ask Dr. Davila to deliver her remarks for today.
Thank you, Mayor Tory, and good afternoon. With the easing of COVID-19 restrictions, it is understandable that there are questions and mixed feelings amongst many of us. For some, these steps could not come soon enough. Others are concerned that these steps will only set us back or are being relaxed too quickly. We have lived with COVID-19 for 2 very long years. Given what we've lived through together, these feelings are entirely understandable, particularly as we have trusted these measures to manage the health risks associated with COVID-19 for such a lengthy period. Over the last 2 years, we have dramatically changed how we live and how we interact with each other. Earlier in the pandemic, as we sought to better understand COVID-19 and the new global threat it posed, we took significant and necessary actions at a societal level to keep each other safe. Together, we stayed at home if and when we could. We stayed apart from family and from friends. We changed how our children and youth learned. We drastically changed how we work and how we do business. We changed the way we lived. These measures were necessary to prevent loss of life, to prevent serious illness, to protect our hospitals and healthcare systems from being overwhelmed, and to make every attempt to blunt the spread of this new virus. At the same time, we have watched science unfold before us at an extraordinary pace. There is still much to learn about COVID-19, the investment in monitoring and research over the last 2 years has enabled our global scientific community to gain a deeper knowledge about this new virus. We've learned more about how COVID-19 is transmitted and the body's response to infection. We can now detect, diagnose, and treat COVID-19 more effectively. We also have vaccines that help protect us, especially against the virus's most serious outcomes. With all that has happened and all that we have learned over the last 2 years, there is much we have accomplished, and perhaps even more to reflect upon. COVID-19 is still with us, and COVID-19 will continue to be with us for the foreseeable future. But there are reasons for cautious optimism and reasons why many jurisdictions are taking steps to loosen COVID-19 restrictions. For our part, we have passed the Omicron peak here in Ontario and in Toronto, and key COVID-19 severity indicators continue to improve. We've seen the number of daily hospitalizations and ICU admissions decline significantly from the highs in these indicators reached in early January. We also have tools and knowledge to protect us against COVID-19, and we can take steps to lessen our own personal and collective risk. There is a global effort to continue to deepen our knowledge about the virus, to share knowledge, to quickly respond, and to develop additional treatments and interventions. We have effective COVID-19 treatments and vaccines that are protecting us against the worst possible outcomes. We know that masking can help stop the spread of COVID-19. We know that when you're feeling ill, you reduce the likelihood of spread when you stay home. With all the tools that we personally and collectively have at our disposal, and given our current local epidemiology, we can gradually loosen restrictions that just a few short weeks ago were so necessary. This doesn't mean that COVID is over, but now is the time to begin to live more fulsome lives with COVID. We can begin to restore aspects of our lives that were necessary to change to keep ourselves and each other safe. This news for some is a welcome relief, and this news for others is very difficult to take, especially for those who are at higher risk, like seniors or immunocompromised individuals, as they will need to continue to practice more strict personal protective measures. Still, we need to find a way to gradually restore activities that contribute to our overall health and well-being. As with so many other stages of the pandemic, the choices that we make in our day-to-day lives do depend on our personal circumstances. As restrictions lift, people will make different choices based on what is right for them. For Toronto Public Health's part, we will continue to monitor COVID-19 and communicate with you, especially about what we are seeing in terms of virus transmission here in Toronto. We still cannot underestimate the nature of this virus and how it can evolve. And we aren't alone in this global effort to engage in careful scientific observation that will continue to inform our decision-making and response. We will provide the best possible guidance on how to keep yourselves, your households, and our community healthy and safe. We will continue to provide public health programs and responses, including our current hyper-local COVID-19 vaccination program that protect and promote the health of all Toronto residents. Toronto residents have responded in extraordinary ways over the last 2 years. Though change can be hard, with patience and understanding for each other, we will adjust and adapt together. I'd now like to hand it over to Councillor Cressy to deliver his remarks for today.
Well, thank you, Dr. Davila and Mayor Tory. Team Toronto's vaccination campaign is one of the largest mobilizations, if not the largest, in our city's history. It's a citywide mobilization to protect each other. It is remarkable. And, as Mayor Tory articulated, we're not done yet. We're continuing to scale up. Last year, health officials set a target of 90% of residents over the age of 12 to be double vaxxed. And I have to tell you, at the time, many told us that in a city of our size and our complexity, that it was impossible. Well, as the old saying goes, it only seems impossible until it is done. And in this campaign, Torontonians have stepped up. We're now nearly at 90% double vaxxed. Among major cities, Toronto is one of the world leaders. Now, this isn't simply good news for numbers' sake. It is fundamentally about the health of our residents, and Toronto's vaccination rate has put us in a position to safely reopen. And as we reopen, this is also the moment to continue scaling up, not down, in our vaccination campaign. So what's next for Team Toronto? Mayor Tory outlined our plans to enhance hyperlocal clinics, to further our community ambassador and outreach program, and to roll out a new third dose conversion VaxTO call center initiative. These are big steps. And so I want to break it down just a little bit further, because in many ways, Team Toronto is running 3 different but aligned vaccine campaigns. The first is a traditional public health immunization drive to operate clinics directly where people are. That's Vax and Read. The second is an old-fashioned community organizing campaign to reach residents everywhere, boots on the ground. That's the Community Agency and Ambassador program. And the third is an election-style get-out-the-vote operation with text messaging, robocalls, and a new third dose conversion call center. That's VaxTO. When people ask me how a city like Toronto, a city with 3 million people, 200 ethnocultural groups, 180 different languages spoken, and where half of our residents are born elsewhere, how a city as large and diverse as that has achieved such high vaccine rates? The answer is this multi-pronged Team Toronto model. Frankly, it's rather simple. Reach everyone, everywhere. Leave nobody behind. That's the Toronto way. And I have to tell you, I also think this vaccination campaign, in many ways, it's just a reflection of Toronto's core values. We all share them. We care for each other, no matter who you are, where you come from. We care for each other. We look out for each other, and we leave nobody behind. And so as we begin to reopen, let me close with this. After 2 hard years, entering this new phase, as Dr. Davila noted, can be both exciting and unnerving, and both feelings are okay. But Torontonians should know this. We have the tools and the vaccination rates to protect us as we gather together again. And we won't stop working. Torontonians should know this as well. We won't stop working day and night, building by building, door by door, to keep getting Torontonians vaccinated. Frankly, at this point, I think Mayor Tory is himself going door by door to get Torontonians vaccinated. And so I have to tell you, I think Torontonians should be deeply proud. This pandemic has tested us, it has hurt us, and in some ways it's tested every city around the world. But Torontonians, our residents, have consistently met this test, and as we enter this new phase, it is my profound belief that our city is stronger and frankly more united than it was before. And so that's something to be proud of. With that, we'll turn the floor back over to Lavin, and we can open it up for questions.
Thank you, Councillor Cressy, Dr. Davila, and Mayor Tory. We will now take questions from the media. As a reminder, it's 1 question, 1 follow-up, and when it's your turn, we will unmute you on our end. First up, we have Antonella from the Toronto Sun. Go ahead.
Good afternoon. This is a question for Mayor Tory and also for Dr. Davila. The province is looking at making masking optional. That could happen in the next week or next couple of weeks. If the province says that they've looked at the data and they don't believe that masking is required in all settings any longer, is Is this something that the city would agree with, and would the city follow suit? And I include schools here as well.
Sure, so why don't I start, and we'll let the mayor add his comments thereafter. You know, Antonella, as I've tried to make clear through my remarks, we are at a new phase in this pandemic. And as Councillor Cressy specifically mentioned, the reason we're at this point is largely due to what Torontonians have done, right? We've all contributed, rolling up our sleeves, participating in the measures that have been necessary to protect ourselves. And, you know, we implemented over the course of the pandemic measures like masking that you talked about. But we're in this new phase, and we know that these kinds of measures that we've put into place to protect ourselves and to protect our communities were always meant to be temporary. So, you know, I think we should be proud that we've gotten this far, that we're at a point where we can actually start to talk about rolling back some of these regulations and restrictions that have been put in place to protect ourselves, and know that we are actively talking with our provincial counterparts and other key stakeholders about what the specific timing is as we seek to roll back on some of these regulations and measures that have been put into place to protect us. But again, I have to emphasize that the reason we are in the position to actually talk about this and to, you know, seriously have conversation of this kind is because Torontonians in particular have stepped up, gotten vaccinated, and participated in a way that's protected themselves and our entire community from COVID-19. So I'll turn it over to the mayor.
Well, I will just support what the medical officer has said, and say that in the context of having supported and adopted the advice that she has given and other medical officials throughout the pandemic. We have made these decisions as we have gone, based on the science, based on the numbers, and as Dr. Davila said, we're in a different phase. Things have improved for the better, and we have adopted a cautiously optimistic and gradual approach to changing things for the better, to reward people, quite frankly, for the fact they have stepped forward and done something in amazing unity, which is to get vaccinated. We're in this new phase now, which has a broader range of options, and I've talked to businesses who want to continue to see people wear masks. I've talked to people who want to themselves continue to wear masks, and they will have a greater latitude of choice on that now because we have arrived at a new point in pushing back on this pandemic, and what we want to make sure of is that there's a consistency in the advice that people see from governments so that they won't be confused by that, and that's why Dr. Davila and others are working with the province to make sure that when the time comes that the rules are easily understood by people and that they will continue to have the choices they wish to make thanks to their own hard work in fighting the pandemic.
Follow up?
Thank you. This is a question for Mayor Tory. Gas prices have skyrocketed due to the war in Ukraine. This is causing a pinch on budgets for the city and for residents. Brampton Mayor Patrick Brown is asking the federal government that it not go ahead with a planned increase in the carbon tax on April 1st. I believe the Ontario Energy Minister, Todd Smith, said something the same today. So would you join in with these two politicians in asking the federal government to delay the carbon tax, or do you think it should go ahead?
I don't know enough of the background to, to be able to give you an expert answer on that, although I think the measure of maybe some very short-term, delay in that, these are important public policy initiatives that we have to move forward with to achieve our equally ambitious and important goals with respect to climate change. But people are experiencing a lot of short-term pain right now. I think you will see some fluctuation back downward when the world situation hopefully improves and we see an end to this invasion of Ukraine, and an end that is done in a positive way, that they just withdraw. So I would take no objection to it, but I would think that if there is anything to be done in that regard, it should be on a very short-term basis, which I hope the dislocation will be as well in terms of pushing up gas prices. But I've learned over, many years watching gas prices, in public office and out, that any measures you take to try and, cushion the blow against these different kinds of market and world forces sometimes can be totally submerged 24 hours later by something else that can happen. And so I just think we should be careful in making adjustments to these kinds of things because of this, what I hope is a very short-term dislocation caused by global events.
Okay, thank you. Next up, we have Francine from the Toronto Star. Go ahead, Francine.
Oh, hi, good afternoon. I want to go back to the mask bylaw discussion. Um, the Toronto masking bylaw, as I understand it, is to remain in place until April 2022. And I'm wondering if either Dr. Davila or Mayor Tory, could you let listeners know whether Toronto would lift the mask mandate in schools if the province did?
So Francine, the situation in schools is a little bit different than that which is, covered by our mask bylaw. The schools are governed through provincial legislation, and it's under provincial jurisdiction. But, as we commented earlier in respect of masking, first and foremost, this was a measure that was taken in order to protect our community as best as possible from the harmful effects associated with COVID-19. And it certainly has done its part, as have all the other measures that have been taken, which includes vaccination. So I think that we do need to really acknowledge that the reason why we're here and able to actually discuss the potential, the drawing back of some of the measures that have been put into place over the last couple of years is because we've made significant progress against COVID-19. We have tools and we have knowledge that we can deploy to help protect ourselves and our entire community against COVID-19. So we're in a position to have these discussions. We're actively monitoring the situation on the ground, COVID epidemiology here locally, and from the province's perspective, the whole province. And of course, we're actively discussing what is an appropriate timeline or fashion by which these measures can be brought back gradually, given how far we've come, given that we're at a different phase in the pandemic, and given that we have these incredible tools at our disposal to help protect us better against the impact of COVID-19. I don't know whether the Mayor or Councillor Cressy have anything further they'd like to add.
I have nothing to add to the substance of what Dr. Davila has said. Dealing with the process which you made reference to, I would only say this, that the City Council put in place an outlying date on which this would be reviewed again, because we've reviewed it several times as we've gone along, and we're basically reviewing these kinds of things every day within the context of the health situation and discussions we have with the provincial government. And we'll be guided very much by, again, the science and by the provincial activities, not in the context that we have to be bound by what they do, but it makes sense to try to achieve a consistency so the public can easily understand what's going on something as important as masking. And so what the City Council has approved, the City Council can change, can extend, but the City Council, when it meets, will be seized of that issue if it wishes to be so, and we'll be basing that on what goes on with the province, the outcome of those discussions, and the advice of our own medical officer of health.
Okay, so to clarify then, it sounds like TPH and the city would consider moving in the same direction as the province when it comes to things like masking and physical distancing and so on.
Say this, and I'm not a doctor or a scientist, but one thing I have learned during the course of the pandemic is that consistency in how we go about making and changing and applying and ultimately waiving these rules is very important to the understanding of millions of people. And that is something that we've learned as we've gone along in this very complex nightmare that we've all gone through together. And so that's why, as Dr. Davila said, we're in detailed discussions with the province about all of these things. In the new circumstance where we've entered a new phase, we want to make sure that as best we can, we try to act together so people are clearly understanding of what the guidance and what the rules will be.
Okay.
I think that's exactly it, exactly as the Mayor has said.
Okay, next up we have Beatrice from CB24. Go ahead, Beatrice. Okay, go ahead.
Okay, I think you should have me now. Good afternoon, Dr. Davila. My question is for you. You've been pretty consistently working in lockstep with Peel Region's Medical Officer of Health, Dr. Lowe, when it comes to specifically inputting restrictions earlier on in this pandemic. Today, Dr. Lowe says, at this point, based on current trends, it is unlikely that he will recommend the extension of the mask mandate when it expires in Peel at the end of March. I understand Toronto's is in April. As it stands today, as you're looking at the current numbers, Doctor, would you also be unlikely to recommend the extension of the mask mandate here in this city?
So Beatrice, as I've tried to make clear here, we're in a good place right now, in respect of COVID. We've seen the Omicron peak behind us now, and we have seen the participation and the uptake by Torontonians of vaccine and their participation in measures, self-protection measures in order to reduce the impact of COVID-19. So as I've tried to make clear, measures like masking regulations were always meant to be temporary, and we are actively discussing with the provincial partners and with other partners around the province, what best, moving back on some of these measures looks like. So that's where we're at now, and I think we're very fortunate to be in this position given all that Torontonians have done to get us in this place. This is a much, much better place. We have tools, we have knowledge to help protect us, and I think we're seeing that benefit in COVID epidemiology at this time. So, of course, we're continuing to monitoring, and we're working with our partners on how best, what the timelines look like for this.
So as it stands today, Doctor, right now, you are not willing to say unequivocally that you are unlikely to recommend to Council to allow the mask mandate to expire.
Beatrice, what I am going to say is that we are actively looking at the situation. We see good signs. We have lots of reason for optimism, tempered with some degree of caution. So we're continuing to monitor the situation, and we're in active conversation with our partners because we knew that these measures, many of the measures that have been put into place, are really about what was needed at the time, and the notion is to draw them back as appropriate in a gradual fashion consistent with what we see on the ground.
Okay, that's it for today, everybody. Thank you and have a great rest of your week.